As I've been introduced, I'm the director of Parkinson's Disease and Movement Disorder at Scripps Clinic. We have quite a big center. These are just some of the neurologists in my group, but we have 2 nurse practitioners who do all my deep brain stimulation programming. We have 3 research coordinators, neurosurgery, and we have a Scripps Integrative Medicine Parkinson's program, which concentrates more on holistic complementary medicine as well as nutritional support for Parkinson's patients. I just want to tell you that I'm very humble with great admiration for all of you people. How can I begin to tell you what to expect with Parkinson's disease? I don't have Parkinson's disease. The closest that I've come to feeling trapped is looking at this out on my terrace every morning or looking down on the golf course from my office window. But what I'm doing every day is I'm in there with you. And so why would I be qualified to tell you what to expect, not having ever had the disease? Well, I've practiced for 17 years. Half of that time was spent in a different medical system with a fairly different culture in England. And then half of it has been spent here in America, all with Parkinson's people, just like you. Right now, I probably have 700 Parkinson's patients. And for those of you here of mine, please don't heckle me. So I do know a bit about it. I do know how to tell you what to expect from a scientific medical standpoint, but only you can tell me what it's like from an emotional, spiritual standpoint. I probably tell people 3 to 4 times a week, new people, that they have Parkinson's disease. I'm sure I still don't have it right, and I would always appreciate any comments or advice that you can give me as to what would help you cope better with that type of diagnosis. So let me just tell you what I have heard when I give this diagnosis. Sentenced for life? Crippled? Will I lose my mind? Will I die? Those are all the questions that are given to me upon the time of diagnosis, and they persist. But within a year, usually a year, sometimes longer, patients are coming back to me with a different sort of language, more like blessed, an awakening, a new lease on life, and I'm as good as I can be. So what I'm hoping to do is take you through that year with these slides and help you understand and learn more about Parkinson's disease so that you can learn that it's not as scary as it is upon the initial diagnosis. And within a year, you'll have more control over your reaction to it. But coming to terms with the diagnosis can be very difficult, and everyone deals with coping with chronic disease differently, just like Parkinson's affects everyone differently. Women's concerns are different than men. I hear women say they're afraid their husbands will leave them. They're afraid of losing their looks. For instance, the loss of facial expression with Parkinson's disease can be devastating to a woman. Men's concerns, usually different, loss of feeling of potency at work, loss of strength, loss of control. Young patients' concerns are different than older's. Young patients might worry about how they're going to raise their children, whereas older patients might worry about their children having to take care of them. A professional diagnosed with Parkinson's disease would have different concerns than, say, a laborer. Should they keep working in their job as an attorney? Are they still able to litigate and present in the courtroom? But a laborer may not be able to do their job from the motor standpoint alone. And it all has to do with your personality and how you, as a person, cope with difficulties in life. But I'll tell you this, just as predictable as the stages of Parkinson's are the stages of acceptance of this diagnosis. And pretty much everyone goes through these stages. One is, it's sort of like Elizabeth Kubler-Ross, stages of death and dying. The first is denial. Often you shoot the messenger, that being me, or the doctor. You begin seeking a second opinion, which I think is sometimes actually a good thing. You begin to have discussions with yourself. It must be something else. The doctor must be wrong. It's probably something I'm doing. If I would just get out of this job, become less stressed, more relaxed, eat better, this will go away. And it's in this stage of denial that most people will say, I don't want any drugs. I don't need drugs. I don't believe in drugs. I can handle this on my own. This stage usually only lasts for months, but sometimes, in really stubborn people, it can last for years. Step 2 is the next logical phase, which is a step of fear and anger. Mainly fears comes out of the unknown, which is why you're here today, so you can mitigate that fear. Also, the fear comes from pre-existing bias. People tend to think they've seen Parkinson's disease, their great-grandmother had Parkinson's disease. They begin to think that's what Parkinson's disease will be for them, but I'm here to tell you it is not the same disease. It's not handled the same way as it was when your grandmother had it. Fear, if there's lack of self-awareness, often turns into hostility and anger. You often direct the anger toward those who are actually trying to help you, those that you love, God, fate, President Bush, whoever you can be mad at. Anger is often manifested by snapping at little things, little disappointments, even though you actually have a big disappointment on your table. If you're in step 2, you're in the right place. Reaching out, not imploding, not involuting, trying to find as much information as you can about Parkinson's disease is the thing to do. And luckily, you live in a community where you have, look around the room, an enormous amount of resources, excellent doctors, excellent resources, and you're not alone. You need to arm yourself with knowledge. You need to reach out, talk to your spouse, talk to counselors if you need to, talk to your doctor. If you freeze on the street or have Parkinsonian symptoms that are obvious to others, instead of getting mad at the onlooker, explain to them what your disease is. It helps. Step 3 is depression. This is very common. I'm sure you're all aware of the signs of depression: crying, despair, hopelessness, loss of appetite, loss of sleep. Most Parkinson's people go through this. It's important for your doctor to decide, is this a reactive depression because you've been saddled with this diagnosis? That's quite normal, but also you should know that Parkinson's disease people in general have a biochemical depression, just from lack of serotonin and dopamine itself. So you may need to talk to your doctor about an antidepressant. I usually use an antidepressant in my patients for the first year. Then most people are able to get off of it, but a lot of people choose to continue it.